Hello, I'm Chris Cummings, CEO of Petra Technologies, and we provide rock-solid IT every day. Today, I'm going to let you know how to check if a healthcare agency that you or a family member have or could be considering has been breached. You may have noticed that you've been getting a ton more spam lately because your email address ended up being sold again from products you bought. Or you could have been one of the people who bought NBA tickets lately and you've been getting a ton more email spam and phishing because the NBA was hacked in March 2023. Or if you happen to own a Ferrari, you would also be getting more spam and special offers because their customer list was also hacked in March. In general, these are huge annoyances and spam filters do their best. But even those time-sensitive emails get missed because they hit the junk box and can have a cause of major impact on your business. But what happens when that hacking becomes more than annoyance? If you're a resident or a business of Oakland, California, their systems were breached by the Lockbit ransomware gang sometime between February 6th and 9th of this year, 2023, down for at least 2 months. And you could not pay bills, you could not get a report, or obtain any permits. And for the employees, it seems that their names, email addresses, social security numbers, and passports were stolen. Then the city issued a notice on March 22nd that they were made aware of another unauthorized bad actor. In another breach in March of 2023, a cancer patient at Willamette Valley Health Network found nude photos of her waist up online that were stolen from undergoing radiation oncology treatment. LVHN refused to pay the ransom, and the hacker, known as Black Cat, started leaking the patient information online. There is now a class action lawsuit filed against the healthcare provider due to the stolen medical records of more than 75,000 people. At what point do you have control versus relying on those you do business with? Are you that business? I would suggest that you get educated about asking the right cyber protection questions and take your business elsewhere if there's signs of issues. At least in healthcare, the government is helping with awareness. Several years ago, the U.S. Department of Health and Human Services put up a website that lists the organizations that have been breached. As required by the HITECH Act, the Secretary must post a list of breaches, unsecured protected health information affecting 500 or more individuals. This includes the types of breach like hacking, theft, stolen devices, unauthorized access, and disclosures. It also lists the source of where the data was stolen from, such as a desktop computer, laptop, server, email, or worse yet, electronic medical records, the most sensitive information about patients. You'll find a link to the government website here and in the notes. With this type of reporting, healthcare is pressured to keep their systems protected and, more importantly, actively working to keep educated about the how-tos. It's one thing to say that it's important and that it's being done, but agencies must participate in associations and work with third-party security specialists to know the correct level of standards and practices. Even an organization claiming to be among the top 15 health systems may not be putting enough into their cybersecurity systems. So until next time, check out who you're doing business with. Find us on Facebook, YouTube, and on the web at Petra Tech IT. If you found this information useful, please share it. If you have any questions or comments, drop them into the comment section and I'll address them in a future video. Thanks.